Yesterday, when we talked about chapter 13, we just did a quick intro, and we talked about observational studies, and we talked about the basics of experiments. So we talked about all the vocabulary words we need to know. So we know that in an experiment, you have subjects or experimental units, plants or humans or bacteria or whatever you're using in your experiment, and you're manipulating one variable. We call that the factor. You could be manipulating more variables, so there'd be more factors. Within that factor, there's a certain number of levels. So if you're thinking about that plant experiment we talked about yesterday, the factor was sunlight with 3 levels, because we had full sun, half sun, no sun. And then the combination of all the different factors and all their levels is a treatment. So we have a certain number of treatments. In that case, we just had 3 levels of one factor's 3 treatments. And then at the end, we have a response variable, which is what we're going to measure or what we're going to compare. Okay? Then I said there were 3 things you had to have in an experiment. You had to control all the outside factors that you could. So in a plant experiment, you want to make sure that all of the plants are in the same temperature. You want to make sure that they're all getting the same amount of water. You want to make sure they're all getting the same amount of food. If you're only worried about sunlight, then you want to keep everything else as similar as possible. You also have to randomize. Let's say you get a bunch of seeds, and maybe half of the seeds in the packet are duds. So you want to randomly select which plants you put into which treatment group, right? So that eliminates potential bias and equalizes what's happening. Then you have to replicate your experiment. So you want to have more than one human or more than one experimental unit per treatment. If you just have one, something could happen, and then you have nothing to represent that treatment anymore. And then, of course, if once you finish your experiment, you want to replicate the experiment again if you're really trying to prove something. One result will not prove anything. You need to show it over and over again. We also talked about blocking, which we're going to talk a little bit more about today. Okay? So the first thing I want to talk about today is we actually want to go through and do a more in-depth experimental design. What am I expecting when you go through and design your experiment? So one way to keep track of everything is to create a diagram. All right? In a diagram, you show that there's random assignment to groups. You show that those groups are assigned to a specific treatment. And at the end, you're going to compare. This is a very simple, generic diagram, but it's a good way to keep track of all of your information. So you want to write it out, but then you want to show it in a diagram form to make sure you haven't missed anything. Okay? We're going to do a diagram on the next slide. So again, you have random assignment to groups, and those groups are assigned to a treatment, and at the end, you're going to have compare your results. All right? So an ad for OptiGrow plant fertilizer claims that with this product, you will grow juicier, tastier tomatoes. You'd like to test this claim and wonder whether you might be able to get by with half the specified dose. How can you set up an experiment to check out the claim? Of course, you'll have to get some tomatoes, try growing some plants with the product and some without, and see what happens, but you'll need a clearer plan than that. So how would you design your experiment? So before we even draw a diagram or anything, I want to make sure we all have the vocabulary correct. So our experimental units are the tomato plants. That is what we're doing the experiment on. There is one factor being manipulated, the amount of fertilizer. There are 3 levels. It says growing some plants with the product and some without, but it also, their claim is you want to see if you can get by with half the dose. So we have a full dose of fertilizer, a half dose of fertilizer, and no fertilizer. That means there's 3 treatments. Since there's no other factors, those will be your treatment groups. And the response variable at the end, I think this one's silly. Generally, if you're doing something with plants, you're trying to see their growth over time. You're doing about fertilizer. But here you're talking about juicier, tastier tomatoes, and you want to test if they're juicier and tastier. So you need to do some way of measuring tomato quality, to have some rubric or something, or scale to measure tomato quality. Okay? That's all the pieces. So if you're going to design an experiment, we have, let's say we have 30 tomato plants at our disposal. And if I'm going to draw a diagram, I have 30 tomato plants. They are randomly assigned into my 3 treatment groups: full fertilizer, half fertilizer, and no fertilizer. And in the end, we're going to compare growth, which seems logical, but really in this case, we're looking to compare tomato quality. All right, now we have a plan. We need to write out what we're going to do. So I'm going to write this out in paragraph form, sentence form. I will buy 30 tomato plants. Now, this is where to be careful. You're trying to eliminate as much bias as possible. I buy 30 tomato plants, all from similar conditions and of similar height. We don't want some tomato plants to be way larger than others. I mean, they're different stages of growth. We want to get tomato plants that are as similar as possible. Then I will randomly assign we want to have approximately equal groups. You don't have to have equal groups. They're approximately equal. I have 30 tomato plants in 3 groups. So assign 10 plants to each treatment. You could say in here how you're going to do that. You can say number them 1 through 30 and then select 10 unique plants for each group. Over the course of, again, depending on your season here, so over the course of the growing season, maybe that's a few weeks, maybe it's a month, depends on where you are with your tomato plants to begin with. I will administer the treatment at suggested intervals. So if it says to fertilize on this brand every day, then you do that every 2 days. While keeping as many outside factors the same as possible. So we're probably going to plant these all in the same plot, in the same type of dirt. We're going to separate them somehow, so I want to make sure I know what plants are getting what fertilizer. Here. Then once the tomatoes are grown, so after the tomatoes are ripe, I will measure plant growth because I think that's logical, and measure tomato quality, which is very subjective, which is why I don't like that very much. All right, so that is your experimental design. You need to have all of those pieces. Okay? I mentioned the experimental units and how many I had. I mentioned the factors and the treatment groups randomly assigned. I might want to, in the paragraph, identify the treatments. But by having a diagram and the paragraph, if by some reason I left something out, at least I've shown it in the diagram, and so the AP grader would know what I was talking about. Okay, so a diagram and a paragraph aren't that bad to have all together. Okay, questions about designing an experiment? All right. Some things that we need to be aware of. when you're doing an experiment, you're trying to you're trying to prove something. You want to have significant results, all right? After Christmas, that's all we're going to be talking about is significant results. Are your results significant? We're going to take all of these results from surveys and experiments, and we're going to go through and talk about what happens with them, okay? So, for right now, you just need to think, if you're asked if something's significant, is the result unusual? That's what I want you to think about right now, okay, until after Christmas. Is the result unusual? If the result's unusual, that means maybe something funky is happening that is some new groundbreaking discovery. If it's the same thing that normally happens, then you haven't done anything very exciting and your experiment might have been a dud. So, you want unusual results if you're trying to prove something new, okay? All right. Here's a quick caution. The experiments and samples use randomization, okay? But we have different reasons for doing things. Sample surveys try to estimate population parameters. So you want a representative sample in a survey. But experiments are trying to assess the effects of treatments. So experiments aren't performed on random samples of the population. You don't have a representative sample in an experiment. Generally, an experiment are just who you could get your hands on or who you could volunteer or what class you have access to. So we use randomization to assign the treatments, but we don't actually have a representative sample or a random sample from the population. Okay, just be careful of wording there. All right. The rest of this today is about specific things that you might need to think about when designing experiments. All right, so the extra pieces. One is a control treatment. Do you need a control group? A control group gives you a baseline measurement. All right. So in our tomato plant experiment, the treatment that got no fertilizer is our control. Right? It's a control because nothing's happening to it. So we're going to see regular growth and we're going to see regular tomatoes, tastiness, juiciness, whatever. And we're going to be able to see how the other tomatoes compare to the tomatoes where nothing happens. Okay? So you want to make sure you have a control if possible. You can't always have a control. Okay? It's not always available to you. For example, if you're doing a drug, always people coming up with new drugs to try to get passed by the FDA. Drug trial people are going to have this heart condition. That means they're probably already on medication. You cannot take people off their heart medication and make them not take any medication and then give half the people like the new drug that you're giving, right? So you can't have a control group in that scenario because that wouldn't be ethical. You have to make sure that you're still treating the people that have the heart condition, all right? So you can't always have a control. Not always possible. Another thing you need to consider is blinding. I like this note from our book. Humans are notoriously susceptible to errors in judgment. Okay? People in your experiment can introduce bias, you eliminate it. And so a way to eliminate bias is by blinding. There are two general groups of people, all right? There are people who could influence the results, so subjects, people that are administering treatment, or technicians or something. There's also people that evaluate the results, judges, people analyzing your results, etc. Okay? If all the individuals in either one of these classes are blinded, then you have single blind. So this is what that might look like. All right? Maybe you're giving two different drugs. So you have two different treatment groups. All right? And one of the groups is getting a sugar pill, so a fake pill, that looks identical to the real pill. Okay? Well, you don't want the subjects to know which pill they're taking. That kind of defeats the whole purpose. You want to see how they improve regardless of what pill they're taking. All right? So there's a control. And if you see any improvement with that group, then you can expect the same amount of improvement with the other group because it's sheerly psychological. You want to keep that group in the dark because you don't want them to know what they're taking. Maybe you who is getting what pill. You just know, the nurse knows there's pill A and pill B, and these people are assigned pill A, and these people are assigned pill B. So you don't want the nurse, maybe she introduces bias by slipping the real pill to someone. You don't want that human element there in case, you know, people get a soft spot for one of the subjects in the experiment. Okay? So if a group of people is kept in the dark, it's single blind. It might also be single blind that everyone in the experiment and all the administrators know exactly what's happening. But as the experimenter, you don't want to be the one to evaluate the results because you're afraid that you will try to manipulate the results to fit what your hypothesis was, right? You want it to end up that you want this new drug to be better because you made it. So maybe you have a third party come in to analyze your results. And so if everyone knew what was going on during the survey, or during the experiment, but then the person that analyzes what's happened at the end doesn't know what treatment was what, then that could be single blind as well. So single blind is when you just have one of these groups are all in the dark. Double blind is when everyone in both the groups are all unaware of really what's happening. Aren't aware of what treatment they're giving or what treatment they're getting or what treatment they're evaluating. Okay? Now, someone in charge, still someone in charge of the experiment that has kept track of all of those things, but they are not going to help evaluate or help administer or anything like that. They just are keeping track of all of those little pieces of information. Okay? So single blind, one group doesn't know, double blind, both groups aren't really aware. Okay? Placebos. We've talked about placebos. You've probably heard of placebo. A placebo is just a fake treatment that looks just like the treatments being tested. So most of the time that's a pill, okay? But it doesn't always have to be a pill. Maybe it's food, all right? You're giving steak to group A and you're giving steak to group B, but steak from group A has been seasoned differently than group B, but it looks identical. They don't know, all right? Something like that. Now, the whole reason for the placebo is the placebo effect, right? Placebo effect is showing that there's some psychological component that can result in some effect on your results. So you have some difference just from the placebo, then you expect to see that same difference with the real drug, and then any improvement on top of that would be your result, okay? So placebo can be important if you don't want people to know what they're getting. You can't always have a placebo, though. You can exercise experiment on different types. Isn't always possible. Then we talked about blocking yesterday. Blocking is where you group people into similar categories, and then you do the entire experiment within those categories. So here is a reason we would want to block the tomato experiment, all right? Maybe you bought your tomatoes from different stores, and so they're different brands, or they've been kept in different conditions, like Lowe's kept their tomato plants outside in the elements, but Walmart kept theirs indoors in the greenhouse or something. But so there might be a difference in those plants. Well then, and block B, they do the entire experiment in both groups. Okay? That way at the end, they can compare all the treatments just for block A. They can compare all the treatments just for block B. Then if block B. Okay? If you have groups and you don't identify them ahead of time and you don't block, then you can't really generalize your results at the end based on that maybe extra factor. So if you're doing something about cholesterol and you think maybe men and women will have a different reaction to a new cholesterol drug or a new diet, okay, then you need to do the entire experiment with just men and then the entire experiment with just women so you can compare within those groups and then compare the treatments between men and women at the end. If not, since there's random assignment, then you might have a treatment group that doesn't have the right amount of people, okay? You can also have multiple factors, and if you have multiple factors, that's okay. You just have more treatments. All right, a quick example, and then I'll be done. So part of the homework assignment tonight, 7 through 20, you're not doing all of those, but they ask you a variety of questions. All right, so the first question is the scenario an observational study or an experiment? So you're still having to practice that. If it's an observational study, then you'll have a list of things that you need to answer. And if it's an experiment, you'll have a list of things that you need to answer. All right, so we're going to do one example and then go through those choices. So it says, over a 4-month period among 30 people with bipolar disorder, patients who were given a high dose of omega-3 fats from fish oil improved more than those given a placebo. All right, so is this an experiment or an observational study? Well, since something is manipulated, because you have omega-3 fats given and you have a placebo given, so the drug is manipulated, so that means you have an experiment. Okay, so we're going to go through and answer all these questions right here. Who are the subjects studied? Well, the 30 people with bipolar disorder. Okay, that's who was in the experiment. The factor or factors in the experiment and the number of levels for each. So we know the drug was manipulated, so one factor, the drug type, with 2 levels, omega-3 or a placebo. The number of treatments, since there's only one factor with 2 levels, there's just 2 treatments. The response variable, it just says they improved, but it doesn't say what they measured. So they had to measure something to get an improvement, but I'm not sure what they measured. They measured some sort of symptom, but I don't know how they did that. So I'm not really sure what the response variable was. The design, completely randomized, blocked, or matched. And we'll talk about matched in just a second. But so right now we've got completely randomized or blocked. It would only be blocked if there was groups, and it doesn't seem to be that there were any groups. So it's just a completely randomized experiment. Whether it was blind or double blind, because there was a placebo, it's definitely single blind. I guess it could have been double blind, but they didn't tell us. And then the nature and scope of the conclusion, this just is what they can try to conclude, and they can try to show that omega-3 fats can reduce bipolar symptoms. Possibly. So they're trying to show a cause and effect relationship between omega-3s and bipolar disorder. Okay? That's what you need to be able to do for part of the homework. 2 more quick definitions that our book goes into, and then I'll be done. One is matched pairs experiments. It's a special type of block design where you have blocks of size 2, or you have one subject getting both treatments, which isn't as usual. All right, so matched pairs would be maybe you have a bunch of people on a blood pressure medicine, but you think that the level of their blood pressure has something to do with how the drug reacts. So maybe you have pairs of people, you have 2 people that have like the lower end of the blood pressure, and then you have 2 people that have a little bit higher, and then 2 people a little bit higher, and then 2 more people are the highest blood pressure. And within each of those groups, one gets a placebo, or one gets, well, probably they're on blood pressure medicine, not placebo. So one gets an old medicine that already is in existence, and one gets the new medicine. All right, so then you can see how the blood pressure level has an effect on, like, how the medicine has an effect on certain blood pressure levels. So maybe it doesn't have a great effect overall, but maybe it really helps people with really, really high blood pressure compared to just sort of high blood pressure. Tomorrow in the activity we do in class, we're going to go through and talk about how you would assign a matched pairs design. I think that'll help. Last is confounding and lurking variables. We've talked about lurking variables in the past. There was an example when we did scatter plots at a scatter plot of cell phone use compared to health somehow, like overall health in a country. So it was kind of showing that as cell phone use increased, that general health increased, but that's trying to show that then cell phone use makes you more healthy, and we all know that's not true. The lurking variable was economic development, because it was for different types of countries. So the higher the economic development, then the more cell phone use, and because there's higher economic development, there was more medical care readily available, which means we'd be a healthier nation. So that was a lurking variable, all right, was economic development. A confounding variable is something where you have two variables that are so closely linked that you can't distinguish which variable from which actually had an effect on the response variable. Like, you can't separate them. We can talk a little bit more about that tomorrow as well. But the confounding is where you have two variables that are so closely linked that you can't separate them. All right? So I'll give you the assignment, and then if you have questions, you can ask during class today.